Hey everyone! So this week we are reading chapter 3 from the core text, and of course that chapter is entitled Resilience and Meaning Making. But if you notice in the syllabus, I talk about elements of loss in terms of assessment and intervention. So most of the people in this class are going to be helpers of some type, right? And I assume that we're taking this class because we want to learn not just about grief, but how to make sense of the grief experiences of others. So what this chapter really does is it provides a framework for different types of areas of information that you want to gather when you're trying to understand someone's grief experience. As we know, grief is complex, and there are so many different factors that can contribute to the way that someone experiences grief and processes grief. And of course, we looked at models. We understand a lot of the different theories about how grief is supposed to unfold. We understand a lot of the different emotional experiences that come along with grief. But in here, we want to really talk about how do we look at different factors for understanding how an individual might be impacted by grief, and more importantly, what different things can we pay attention to, and what strengths can we also pull out in terms of things that we can really try to promote or support or encourage a person to get more of a certain type of health that we know is important. So that's what we're doing. It's really, again, how we assess grief, but that's not with like an assessment tool. That's with looking at a lot of different facets so we get a complete picture of someone as we're trying to help them. So grief is a stressful experience, right? It's intrinsically a very stressful process, and grief experiences are often among the most stressful events in life. I love this image of this woman who's crying because you can see like she's really sad and upset, but it also looks painful. Grief it's exhausting, and stress has a lot of impacts on us mentally and emotionally. So here's one definition of stress. Stress is defined as the body's non-specific response to demands made upon it or to disturbing events in the environment. It is not just a stimulus or a response, but rather it is a process by which individuals perceive and cope with environmental threats and challenges. And we can imagine grief experiences are often perceived as very threatening, and there's often a lot to cope with. In small amounts, stress is normal and can help individuals be more active and productive. However, very high levels of stress experienced over a prolonged period can cause significant mental and physical health problems. So, we talked about grief is very painful. It's a very normal part of life, but the more complicated it is, the more drawn out it is. Even if there might be little moments of pain when someone is, for example, really depressed when they're grieving, that can just cause a lot of wear and tear on the body and the mind. So in this chapter, they really talk about a lot of different kind of coping and stress models, and various ones may be applicable, but finding a specific model is less important here, as it is to understand that coping skills and other intra, which is internal, and interpersonal factors can really mediate the impact of stress in grief experiences. So again, we're looking for different factors that can help promote well-being and also locate different factors that can be a risk for making grief more intense or worse. As I said, models vary, but grief researchers have identified a number of just really common mediating factors that can affect the grief process. And of course, mediating means that these different factors, the existence of them, can really change and shape the intensity and the course of the grief experience. This is just a broad overview. We're going to dive into them more specifically in a minute. This includes background characteristics, relationship to the object of loss. These are kind of objective things that just are. Then there are personal capacities, and these are more kind of interpersonal strengths, practices, whether or not you have coping skills, and then interpersonal. These include social, communal, and cultural capacities. We've already spent some time talking about the importance of culture on grief, but of course your social life, your community can also really impact the way that you grieve. So in this text, they're really working out of what they call a resilience framework. And so resilience research is focused on identifying both risk and protective factors. What's important about that in this kind of framework, you're supposed to look at risk and protective factors, that there's been a movement in the last 20-ish years, I'd say, in healthcare, really I think starting in mental health, to look at not just where someone is struggling, but also where their potential strengths and buffering factors, right? So this also relates to a wellness model, which is really kind of the foundation of the counseling field, which I'm in. The concept that we don't just want to look at where people are struggling. Again, we also want to look where there are strengths, because we can utilize those and encourage those and help support those so that an individual can be well. Resilience is defined as the behavioral patterns, functional competence, and cultural capacities that individuals, families, and communities use under adverse circumstances, and the ability to make adversity into a catalyst for growth and development. That's another theme kind of in this chapter, is the concept that grief can be an opportunity for growth. And I think that is a really important point, but on the other hand, I think you also don't want to just tell people that are grieving, like, this is just an opportunity for you to grow, right? There's going to be sadness and hardness, and we don't want to just be overly positive. But we know that grief can turn into a lot of growth and awareness. I know that in working with a lot of cancer patients, as they were thinking about, oh, am I going to die, preparing to die, they're preparing to die, but more and more people are living after a cancer diagnosis because treatment has gotten much better. But you would often find that experience of cancer was kind of like a catalyst for them to just live the life again that they always wanted to. Maybe they chose different relationships. They took that trip they never took. Grief was a catalyst for them to live their lives more fully. So that is an important element in this framework, the idea that the adversity of loss can turn into a catalyst for growth and development. So in this framework, we're going to look at some background characteristics, adversity factors, different types of capacities, and looking at overall mental and physical well-being as an outcome. So let's get started in looking at some of these factors that you want to consider when you're talking to people about their grief experiences, to kind of make sense of where they are and if there's any way that you can intervene or support them. So the first, talking about background characteristics, and remember, background characteristics are kind of just things that are gender. So there's a nice discussion about this in the text. We know that in terms of the way people grieve, you could see kind of common patterns that are somewhat can appear gender specific. As I mentioned, females tend to have more of what's considered intuitive grief, where there's more emotion, there's more expression of feelings, more awareness of inner feelings. They consider this more feeling than thinking, although feeling and thought are not mutually exclusive. Focus on exploring, expressing those feelings, processing them, whereas males, you will often see them grieve in ways where it's more physical or cognitive. Maybe they want to do tasks or get things done. They want to be more logical about it. They want to find behaviors to keep them busy. They're focused on doing and actively responding, and that's considered a more masculine way of grieving. And in the text, I think one of the authors talks about how when she lost her son, she noticed that her husband started building a boat with his other son. And she asked, when you were with our other son, did you talk about our son that died? And he said, no, we were focused on the boat. And she was thinking how she would have actually brought up the son that had died and had that conversation. And that kind of illustrates commonalities that we see in genders and the ways that they grieve. However, most people in the fields believe that these different styles of grieving are not necessarily intrinsic in the way that it has to be. Men are not less feeling than women, and women are not less thinking than men. But there are different ways that we're culturally expected to respond to different things, and that can have a huge influence on the way that we enact in the world. Gender norms, man, they get you every time. So it is on a continuum, and of course different individuals can have a continuum of being more emotional and intuitive and more instrumental and kind of cognitive and behavioral. Also should be noted that, one thing about working with men is that sometimes they don't reach out for the same types of social support. They don't always know how to express those feelings. And in particular, the lack of social support can sometimes be a hindrance to them getting what they need. But also, on the other hand, sometimes people don't need to always talk about their feelings. Sometimes just doing something helps. So you have to take every individual on a case-by-case basis, but just be aware of some of the common things that we know between genders and ways that they choose to grieve. Other important background characteristics include age and developmental stage. And of course, this is something that we're definitely going to be looking through as a lens in the several weeks in this course. What this means, it's important, of course, like how old the person is when they experience the loss first, in terms of when a child is grieving, they don't always understand loss in the same way, but that doesn't mean that they don't experience strong emotions. And so sometimes it can be more challenging in working with children how to communicate what loss is and how to help them understand it in a developmentally appropriate way, which is something that's so, I think, great about people who work with kids, because kids need those kinds of supports and people who meet them where they are, versus an older individual who is maybe in their 80s and they've experienced a lot of losses already. They've lost a lot of friends, lost a lot of jobs, lost a lot of homes, relationships. As we get older, we can gain a greater capacity for loss because we get used to it, but that doesn't mean that it still doesn't impact us and isn't still important. Another important factor when it comes to age and developmental stage and loss is also, particularly in cases of death or when certain things happen to us, when those losses happen, do they happen at times that are developmentally normal? Such as one of the greatest losses we can have is the loss of a child. And so that is something that often young mothers are often not expecting or prepared for, because it just seems wrong. It's not the order of things, right? They're expecting to outlive their children, not lose their children. When a child dies, it just seems just against the order of things. Whereas someone who is older, that kind of makes sense. If they've lived a pretty natural life, I think 90 is considered the ideal age in terms of human capacity, like when our bodies are really that's kind of their peak. So, yeah. Age, developmental stage can really influence the way that people grieve, etc. Another important factor, ethnic minority status and culture. So there are actually different types of minority groups. In the book, it really focused on ethnic and racial minority statuses, but that also includes ability, religion. In the United States, for example, we know that there has been a lot of discrimination against Muslim individuals, and that is a very large world religion. And being in the United States and being a practicing Muslim, if you were to experience a loss and you were trying to grieve in the way that was consistent with your religious practice, you might experience discrimination, which could lead to a sense of disenfranchised grief. Similar with sexuality and gender expression, gender identity. Gender's not just an expression. But this, again, just links into different conversations we've had about disenfranchised grief and how if you are in any type of minority grief, it is going to be more likely that you're first not necessarily going to get the social support or recognition that you might deserve. And another huge, just mega important concept here is the concept of socioeconomic status, because we know that your ability to have financial resources in this country, because the way that we have different kind of laws and different barriers, if you are any type of minority, you are less likely to have access to different types of financial resources. There are different reasons for that. Again, trans individuals can, if they're not passing, they can have a very hard time finding employment, which is not fair by any means. But can you see how that can lead to limited access to a job to make money, which also leads to things like lack of access to healthcare, to education, even having a home, having a clean water, having healthcare services regularly, all of these things, having food, all of these things are incredibly important. And if we think about Maslow's hierarchy, right, if you don't have your basic needs met, it's really hard to deal with your emotional needs. So anytime you're working with an individual who's any type of minority background, it's really important to not just understand that emotional and mental experience, but also understand functionally how does that impact their ability to have access to resources that we all deserve. Because if you don't have access to healthcare, if you don't have stable housing, if you don't have, again, just financial resources, that's going to make a lot of parts of the grieving part more difficult, because a lot of types of grief experiences, from death to things like, losing a home, needing to move, the immigrant experience, all of those things are helped by the ability to, again, establish a new normal, find new resources. You often, when you're paying for a funeral, when you have to get a new car, when you have to get a new house, those things take money. And so I just think that's a really, really, really important thing to consider. I have done a lot of cancer research, and it's also really sad in this country that Black and Latino individuals are more likely to die from cancer, for example, because they don't have as much access to health care. And even when they have access to health care, there are often symptoms can be dismissed by doctors because of inherent bias. So I'll get off the soapbox. I'm just saying it's a very critical thing. You should make sure that you are aware of these facts because they're real. Also, a background characteristic, the nature of the prior relationship. So I have a couple examples here. So in the bottom, I have this example of these women with their father, and it looks like they have a happy relationship, right? I have a great relationship with my dad. He's probably my closest family member. I love him. He's my favorite. He adopted me when I was, he kind of took me in when I was in the 6th grade and raised me, and he adopted me after I finished college. But to me, like, when I lose that relationship, I know it's going to be one of the hardest losses in my life because he's just been such a cornerstone for me, and I just love him. Whereas, like, when we have relationships that we feel complicated about, as we've mentioned before, sometimes people experience grief differently. If you have if it's the loss of a spouse and you weren't as positive on them, or there was a lot of complication, if you have a parent that you have a really complicated relationship and they die, there can be mixing of relief and pain. Also, similarly to different types of losses, such as your job, when you're let go of a job that you really loved, that can really hit you really hard if it's something you've worked hard for, got a lot of education for, took a lot of joy out of. Maybe you're in an artistic career and you're pursuing something because it's your passion and it doesn't work out. That kind of loss is going to be more painful versus a job that you hate, and so it's fine. You're just moving on to the next thing. Similarly about, your home. We talk about losing the home often is a really negative thing, but imagine if you hated your house and it burned down and you got insurance money to build a new one that you actually liked. It might, again, impact you differently. So those are all sort of different just background characteristics. They're things that are kind of, they were what they were, they're somewhat immovable. Next kind of set of dimensions are related to adversity. And so there are really two major categories here. First is kind of, is it a traumatic loss or not? And we've talked about this before, that, this is an image here of an old woman. Let's say she's in a nursing home and she's been sick for a long time. She's going to pass away soon. While this is challenging and painful, we know that when people have the opportunity to prepare for a loss, when they know that it's coming, when it kind of makes sense developmentally, as we've talked about, or again, they just have plenty of clues to know that it's going to happen, grief tends to be a little bit less intense because you have some time to kind of have anticipatory grief. You're kind of mentally preparing. But when there's a kind of trauma, we talked about things like homicides, major accidents. We've talked about natural disasters that can harm lives and also harm, property, homes, financial resources. When it's a shock, it's just going to be a little more intense. So you need to know how to assess for different factors of trauma when you're working with individuals. And it's good to know, again, if the loss is more shocking, it's more likely to be a more difficult experience. Because again, we talked about how when we have trauma, it can really challenge our concept of an assumptive world. So you often have to help people find a new sense of safety and stability. And then the other major element when it comes to talking about adversity and grief experiences are the accumulation of unresolved prior losses. So this is when an individual has already experienced a great amount of loss and they are just exhausted, and it makes it difficult to work through your grief when new things keep happening. So these are some different proverbs kind of right below me from different countries around how when bad things happen, they sometimes happen in groups. So it never rains, but it pours. When trouble comes, leave the gate open. Misfortune seldom comes alone. And this sort of made me think about, I recently watched the movie Midsummer. One student wrote their paper about this. I don't know if you've seen it. It's kind of intense and creepy, but spoiler alert, it's about a woman who starts off the movie with losing both of her parents and her sister when her sister commits suicide and gasses the whole house and also kills her parents. And then this individual is also dealing with the loss of her, realizing that her romantic relationship is failing. And so even weird Swedish cult aside, we get to see this woman who's dealing with loss on top of loss and top of loss, and it just buries her. So she is more open to cult advances because she wants someone that's going to be there for her, and the cult, it's there. I also think about the experience of having an illness, right? That can be a major source of grief and loss. When you get a very serious illness and it's life-threatening in some way, or it takes away some physical capacity that you used to have. Working with cancer patients, they'd often be grieving their experience of having cancer, but it's also becoming more and more common in this country to go bankrupt because you have a type of physical illness, especially something like cancer. I mean, it is insane. The system is not working for people. But when they have $70,000 bills that they can't pay, and they have to decide if they're going to fight for their life or pay all that money, and they can lose their house, they can lose all of these things. I mean, that is it's just a horrible situation to be in. We can understand how when losses are accumulated that it makes it much harder to do that work. Next category are capacities, and so these are different resources, internal and external resources that people can have. And so personal is a large category, so I do have some text on the slide, but we know that personality factors can make a difference in how people approach grief. There's been a lot of research on resilience and why certain people are more resilient than others, and that research is ongoing, but I don't think we want to say like, oh, this person doesn't have good personality factors, they're not going to make it. There are different types of strengths that people can have. So those include being assertive, flexibility of thought, understanding that life is going to change, tenacity, being optimistic, the ability to distance yourself at times from what's happening in emotions. As we've mentioned, sometimes some avoidance is actually quite instrumental. Intelligence, group consciousness, are you very aware of others? Are you aware of how this is also impacting others so you don't feel as alone in your experience? And a huge one, the ability to find meaning and courage in one's life. And that also maps onto some of our concepts of the meaning model by Niemeyer, that individuals who can really tell their story and find new meaning in it, that there can be a lot of growth from that. Spiritual and religious practices are another huge source of often comfort and help for individuals, because these spiritual and religious practices are really about meaning and the philosophy of what life means, how I'm going to practice and do life. It's important to note that some religious practices can be damaging in individuals. I think of the example of if you have a very conservative religious group, Christian or otherwise, where suicide is looked at as like a sin, the way that, and say a family loses a child to suicide, in some cases, some churches might not come around that family in the same way, almost as if to punish them for what they saw the other person do as a sin. So that can happen. So that's also important to remember. But religious and spiritual practices are often a source of meaning-making and strength for many. As I said, there's just this common theme around being able to make new meanings. But again, that's going to look different for different people. So when you're looking for strengths within individuals you work with, look at the ways that they're trying to build new meaning in their life. Sometimes that's emotional. Sometimes that's even a new belief system. Sometimes that's a new job or a new project, a new hobby, a new habit. Those can all be positive ways that, to me, connect to the restoration orientation and the dual process model of, again, finding new normal and investing your energy in new places. A lot of people support the idea that individuals have healthier grief when, again, they can have new meaning making and they're driven to do that. But as I said before, we want to be careful not to push a silver lining approach on people by saying immediately, oh, you've experienced this loss, well, what are you going to learn from it? That makes sense how that could limit someone's emotional experience. But on the other hand, we want to, as people are ready, highlight when they are making positive new meanings for themselves. Cultural capacities, which we've already talked about, I thought we talked about in length a couple weeks ago, in terms of course, you're going to be influenced by the cultural messages around grief and grieving if you're taught to do it alone, as we often are in particularly white American culture. But there are other cultural expressions about that. There was a lot of conversation around the African American or the Black church in the United States. If you are a Black individual, I would love your thoughts on how you felt that they handled that conversation. As we talked about, even other cultures like in Mexico, where there can even be celebration of loss, of death in particular. So cultural messages are a huge factor, as well as kind of your more immediate social environment and your family. So if you have a supportive family and if you have a supportive friend group or whatever that is, spiritual community, that is often going to be a positive factor for most people. It just is. Social support is a huge buffer against stressors. But that means if you don't have necessarily that support, it can be a lot more difficult. If you're in a family that is hostile, if you're in a family that is very separated or distant, or say you're not connected to friend groups or other types of communities. Because when we're grieving, loved ones and even friends and neighbors can really do a lot to care for us. That, bringing us meals, checking in, walking our dog for us, giving us an ear to listen if that's what we need. People don't just need emotional things, they also need functional help when they're grieving. But a few things to note. First, the book talked about how it's often helpful to grieve with people experiencing similar things, and they gave the example of a cancer support group. And so this is something I've done specific research in. And what I found interesting is that, yes, a lot of people benefit, or at least from cancer patients benefited from being with other cancer survivors. But sometimes it was actually far too much because maybe more group members died or there was just too much pain and loss and they needed a little bit more distance. So while specific groups to specific losses can be helpful for many, sometimes people want more space from their loss experience, and being around others who specifically experienced that can just be too much for them, which makes sense, I think. The other is that sometimes losses actually have a negative impact on our social support system in terms of if people don't know what to say or do and get awkward. And so it's this unfortunate reaction that some people have when there's a loss, like someone loses a child. They don't know how to talk to that person about it or be there for them, so they just distance them and kind of ghost them. So you also want to be talking to individuals about their social support structures, also with the awareness that some social support structures can be great, some individuals can be great, some can also be well-meaning but also not be extremely helpful if they're giving a lot of just, oh, that person's in a better place, or oh, everything's going to be just fine, instead of letting that person feel pain. And sometimes people actually distance themselves when there's a loss experience. So lastly, we just want to remember that our goal in working with people is to just promote their well-being. And why this is important, again, well-being is a holistic concept. There are many facets to well-being: spiritual, emotional, intellectual, physical, social, environmental, and financial. And when you're trying to help someone through grief, you don't just have to focus on one element. The idea in the wellness model is that you promote growth and health in any of these areas. It helps the total system in some way. Also, you can't help every facet. So when you are thinking about how to work with individuals that are grieving, it's important to be aware of the grief experience, be aware of grief models, but also I think it is helpful to look for some of those risk factors and also some of those protective factors. So that is what this week is all about. How do we assess individuals that are grieving? It's obviously we've also talked about complicated grief and when that can start to be a thing and what that can look like, but it's also just with everyone that's grieving. It's helpful to understand what are some of their, again, risk factors and some of their strengths that they got to work with.